Hi everybody, it's been a while since I made a video. I've been busy working on some other stuff, which, you know, I'll share a link to one piece that I've published recently. This video is specifically really to look at public interest as an issue in terms of news coverage, and why I believe that the British public has a right, if not a duty now actually, to bring a class action against BBC News as a news provider that we are actually compelled to fund by law. You know, that we are all compelled to pay a BBC licence fee. And so I'm here drawing attention to IPSO, Independent Press Standards Organisation, and this is an Editor's Code of Practice. So the Editor's Code of Practice sets out the rules that newspapers and magazines regulated by IPSO have agreed to follow. The code is written and administered by the Editor's Code Committee and enforced by IPSO. The latest version of the Editor's Code of Practice come into effect on 1st of July 2019. So now, alright, the BBC isn't a newspaper or a magazine, but one would expect, BBC licence payers would expect, that the BBC upholds similar, if not higher standards than applies generally to newspapers and magazines. And most of the British public still, even to this day, would hold that view that, you know, would you trust something more that you've read in the Daily Mail or that you've seen on BBC News? Okay. Now, there is the point here of public interest, and that's the point that I'm going to be paying attention to here. Okay, so it says here, there may be exceptions to clauses marked star where they can be demonstrated to be in the public interest. And that is in relation to certain titles here, like hospitals, reporting of crimes, children, suicide, etc. That, if it's deemed to be in public interest, they can override certain clauses if public interest outweighs the interests of certain individuals or organisations that might otherwise receive negative publicity. Sometimes it is in public interest that an individual or an organisation receives negative publicity if that individual or organisation is a danger to public interest or working against public interest. So, the public interest includes, but is not confined to, detecting or exposing crime or the threat of crime or serious impropriety, protecting public health or safety, protecting the public from being misled by an action or statement of an individual or organisation, like, for example, let's say the Imperial College. Okay? Disclosing a person or organisation's failure or likely failure to comply with any obligation to which they were subject, like, for example, the NHS obliged to provide cancer care to cancer patients. Disclosing a miscarriage of justice. Raising or contributing to a matter of public debate, including serious cases of impropriety, unethical conduct or incompetence concerning the public. Disclosing concealment or likely concealment of any of the above. There is a public interest in freedom of expression itself. The regulator will consider the extent to which material is already in the public domain or will become so. Editors invoking the public interest will need to demonstrate that they reasonably believe publication or journalistic activity taken with a view to publication would both serve and be proportionate to the public interest, and explain how they reached that decision at the time. An exceptional public interest would need to be demonstrated to override the normally paramount interests of children under 16. So, children under 16, paramount interests, and surely one of the biggest interests for children under 16 is to protect their mental health as well as their physical well-being, because, you know, children are developing human beings, and the unique speciality of humanity is our intellect, isn't it? Our psychology. So therefore, children's psychological welfare is actually every bit as important as their physical welfare, if not more so. Because one can be severely disabled but still achieve a lot if one has a highly developed intellect and a stable psychology. One can be perfectly healthy, but if the psychology is being damaged, then, you know, that person fundamentally is disabled and limited as what they can achieve in through their life's existence. You know, this is a fact. So if anything, children's mental health has to be of paramount importance. Okay? And, you know, it's going to be clear why this last clause particularly is so important when it comes to bringing a class action against the BBC and possible, if not probable, criminal prosecutions against certain government ministers and certain British organisations, like, for example, the Imperial College. So now we're going to move from the BBC to a real news provider, somebody who provides actual facts and doesn't try to spin them in order to fit a particular agenda or government promoted propaganda scheme. So this is James Corbett, and he did share this, when was it? It was last year, April time, that this was published. So it's COVID-19 fatality rate, worst miscalculation in human history, PH student in epidemiology. I always find that really difficult to say. So this is the article that was published in Alternative News, Collective Evolution here. COVID-19 fatality rate, worst miscalculation in human history, and it's based on a peer-reviewed article published by Dr. Ronald B. Brown from the University of Waterloo in Ontario, Canada, based on his research that the coronavirus fatality rates we are given represents worst miscalculation in human history. And here Dr. Brown, this is a statement that he gave to John C.A. Manley, a journalist who was the first to cover the story. Okay, and this is what Dr. Brown has to say here. The subject of this article is disruptive, to say the least, although it is not as obvious from the title. The manuscript cites the smoking gun, documented evidence showing that the public's overreaction to the coronavirus pandemic was based on the worst miscalculation in the history of humanity, in my opinion. My manuscript underwent an intensive peer review process. You are the first media guy who has responded to my invitation. Dr. Brown added that CDC and WHO documents show that the case fatality rate for influenza was similar to the coronavirus, implying that the lockdowns were pointless. His paper questions why the 2017-2018 influenza season in the United States did not receive the same intensive media coverage as COVID-19. And, you know, myself and others who've been doing a bit of research, we have been asking exactly the same question. And this is, you know, an article that I've recently published. I'll leave the link to it under here. And it's got all these other links in it, going through the data from previous years, you know, 2017 to 2018, 1999, 2015. You're talking like thousands per week of people dying of flu related illnesses. Okay, so you know, like for example this year apparently there's hardly been any cases of flu. Okay, because apparently, you know, we've been locking down and wearing masks, and so flu's almost non-existent, whereas COVID cases are rising exponentially because we've not been locking down well enough, and we haven't been adhering to the rules well enough. You know, not enough of us have been wearing masks. Somehow this seems to work both ways. Of course it doesn't make any sense. The only sense it makes is that yes, the PCR tests are picking up anything and everything and claiming it's COVID-19, that a lot of people who have common colds and flu are being diagnosed as COVID. And that's why suddenly, you know, week 51, towards the end of December 2020, there were only 922 cases of acute respiratory infection incidents in England. And that means, you know, caused by an infection like flu, for example. And the week before, so week 50, only 860. That's compared to thousands being hospitalised in, you know, 2017 to 18, for example, or 2015 to 2014 to 2015, when thousands, you know, you were talking about 43,000 excess deaths on top of the regular deaths, because don't forget, over 600,000, almost 600,000 people die in Britain every year of anything and everything, okay, of all ages and backgrounds. We're talking about excess deaths on top of the usual expected number of deaths. 43,000 in the space of 4 months. And I think that was 2015 to 2016, or it might have been 2014 to 2015. You know, the link's there. Check it. I think it was 2014 to 2015. The link's there. Check it for yourself. Okay. So, you know, flu, the figures have been twisted to suit a particular narrative. And don't forget, you know, we've got people who have been dying in car accidents being labelled as a COVID death because, you know, they unfortunately had experienced that accident within 28 days of being tested positive for COVID-19. And somehow that's okay to include that person who obviously didn't die from COVID-19, perhaps didn't even show any symptoms, was asymptomatic, but it's okay, we can include him on the COVID or her on the COVID death lists. And the BBC has not questioned that. That's been down to members of the public. That's been down to the gutter press, like the Daily Mail, where, oh yeah, it's okay for them to publish these little niggly facts. It's all right for the BBC to ignore them because it is not in the public interest, is it, to be informed that, well, actually, the numbers of people that are dying of COVID are actually a lot lower than what are being bandied out by the BBC. And why? Why? Why then? Why would there be a need to maintain a level of public fear and alarm by essentially, as a news provider, be overestimating the number of people that have died from COVID-19? What is the purpose here? What is going on? Now, you know, we know for a fact that the cases, positive test results do not mean COVID cases. You know, somebody who's asymptomatic is not a case of anything. You know, I could be tested for any number of flu viruses, come up positive, but actually I've got no symptoms, therefore I am not a flu case. I'm not going to my doctors, I'm not taking medicine, I'm not going to turn up at hospital with, you know, complications arisen from my flu. I am asymptomatic and I am unlikely to be spreading it to anybody, as a mass screening programme of more than 10 million Wuhan residents identified 300 asymptomatic cases, but none were infectious, according to a study involving the University of East Anglia. So this was a joint study then. Wuhan, China and East Anglia University, they studied 10 million Wuhan residents. This is according to the BBC, where the virus broke out. Okay, they're all living a normal life now, no mutations, nothing. Okay, 10 million, 300 asymptomatic cases were identified and none of them were infectious. Okay, but according to British scientists, okay, this was published at ScienceDaily.com, according to them, apparently China's study on 10 million people is not proof that asymptomatics can't spread the virus. That isn't proof. Well, I would like to see, you see, a BBC that is turning around and saying, all right then, well, show us the proof that asymptomatics can spread the virus then. If you're going to say that this study on 10 million people is not proof, then please do a similar study and show me the opposite. Show me how this isn't proof, because right now people are on lockdowns, they're being forced to wear masks, they're losing businesses. Up to 10 million people in England may need support for their mental health as a result of the pandemic. That includes 1.5 million children, 15% of Britain's children, 15%. As a result of the methods of dealing with an alleged pandemic, which we are informed in no uncertain terms is the worst miscalculation in the history of humanity, given to us by the Imperial College and Boris Johnson and co. And here is the report. Public health lessons learned from biases in coronavirus mortality overestimation. Ronald B. Brown. This is the article referred to. I've just referred to. Intensely peer-reviewed. Do not forget that. Intensely peer-reviewed. Not just peer-reviewed, intensely peer-reviewed. In testimony before US Congress on March 11th, members of the House Oversight and Reform Committee were informed that estimated mortality for the novel coronavirus was 10 times higher than for seasonal influenza. Additional evidence, however, suggests the validity of this estimation could benefit from best vetting for biases and miscalculations. The main objective of this article is to critically appraise the coronavirus mortality estimation presented to Congress. Informational text from the World Health Organization and the Centers for Disease Control and Prevention are compared with coronavirus mortality calculations in congressional testimony. Results of this critical appraisal reveal information bias and selection bias in coronavirus mortality overestimation, most likely caused by misclassifying an influenza infection fatality rate as a case fatality rate. Public health lessons learned from future infectious disease pandemics include safeguarding against research biases that may underestimate or overestimate an associated risk of disease and mortality, reassessing the ethics of fear-based public health campaigns and providing full public disclosure of adverse effects from severe mitigation measures to contain viral submission. So here we have, fear-based, the ethics, reassessing the ethics of fear-based public health campaigns, and that is exactly what the BBC has been involved in, and it has had most power and most influence because it is the most trusted. It is more trusted than the general news press, newspapers and magazines. It has more reach and power and access into people's homes. And we're talking about the worst miscalculation in the history of humanity. In an intensive, peer-reviewed article that's been written by, it was published in published online by Cambridge University Press, 12th of August 2020. Intensely peer-reviewed, nothing at all from the BBC about this. No questions, no resulting questions asked to government ministers, nobody talking about the dire impact on children's health, on children's mental health, on adults' mental health, and let me tell you, it's a lot more than 10 million. I would say at least 30, if not 40%, if not 50% of Britain's children and youth are suffering as a result of the measures allegedly rolled out to protect their health based on the worst miscalculation in human history. And that's come directly from Imperial College. And who's behind it all? Oh, we find Bill Gates. Bill Gates behind all the vaccines, the Pfizer vaccine, the Moderna vaccine, the AstraZeneca vaccine. And, where was Bill Gates in November last year? Oh, meeting Boris Johnson at number 10. We're talking about private corporate interests here exploiting a dramatically exploited pandemic. Overestimated the deaths, the figures, everything. Even the PCR test, 95% false positive, as it even explains here. A court ruling in Portugal judged that the tests were not fit for purpose. We're talking about 95% false positive, 97% false positive. Here we go. A verdict that condemns the widely used PCR test as being up to 97% unreliable. Now, we're being asked to accept a vaccine, and, I'm not pro or anti-vaccine, okay? I am pro-informed choice, but I do have to balance the information that we're being given here, okay? I think that we have a right and a duty to do that, to put everything on balance here. So, we're being advised and pushed to receive an unlicensed experimental vaccine. This one's the Pfizer vaccine. Okay? And, according to Pfizer, they've studied 43,661 participants, a mixture of race and ethnically diverse backgrounds, and they've said that efficacy was consistent across age, sex, race and ethnicity demographics, with 94% efficacy in people over 65. But here's the kicker. No results from the trial have yet been published in a peer-reviewed journal. So here we have an intensely peer-reviewed publication explaining that this alleged pandemic has been the worst miscalculation in human history, and therefore has inflicted immense damage. Children who were at a 0.01% at most risk from coronavirus are suffering 15%, and that's identified. 15% of them are suffering mental health problems that could damage them for the rest of their life and severely limit their abilities in life to enjoy life. We're talking about long-term damage here, and also to their parents and other adults who've lost businesses, jobs, who've been worried, scared. People have committed suicide. Children have taken their lives. Why aren't the BBC asking questions about that in the interest of public health? But in fact, failing to ask any questions in order to protect the people at Imperial College, in order to protect Boris Johnson and his best friend, Bill Gates, in order to protect their interests. Now, this is the British Medical Journal. So the people of Britain are being... The BBC is happy to promote and push all kinds of literature coming from Pfizer about their vaccine. Oh yes, I mean the BBC have done a whole articles. You can get onto their website and you'll see everything you want to see about the Pfizer vaccine. But you won't see that it has not yet been published, that the results of the trial have not yet been published in a peer-reviewed journal. That is because the trial is ongoing right now in Britain. And most of the people participating in the trial, who ordinarily would be paid and have to sign a contract agreeing to participate in the trial and agreeing to a set amount of compensation should anything go wrong. Oh no, that's all been waived because we're in the middle of a pandemic that's based on a serious miscalculation, the worst miscalculation in human history. And the Pfizer vaccine, you know, the results have not been published in a peer-reviewed journal. Now, why is it important to have a peers to review data? Or data, as they like to say in America. Okay? Why is it important? Well, for example, a peer review may ask, well, what percentages of the participants had underlying health conditions? How did you determine who had COVID-19? Did you use the PCR test that's 97% false positive? What was the placebo? You talk about a placebo group. What was the placebo? There's all number of factors. And we're talking about 160, what was it? 170 something people had developed COVID, and only 8 of them apparently were in the, you know, they don't talk about whether these people that had developed COVID were in the, you know, were serious symptoms or were the asymptomatics. Could it have been the same really? Did they show bias the way that they were doing the tests? Were they testing, running them at higher cycles for the people who were in the placebo groups and at very low cycles for people that were in the vaccinated group in order to cook the figures? Was there any of that going on? How do we know? We're talking about a for-profit organisation. We're talking about money here versus people's health. We're talking about an intensely peer-reviewed document here, written by a guy with basically a double PhD. He's working on his second PhD. Explaining that this whole pandemic is based on the worst miscalculation in human history. And that the result of it is that people have been denied healthcare. People have lost jobs, they've lost businesses, they've lost their rights, they've lost their freedoms, even freedom of speech and expression. Videos taken down. The last American Vagabond here, another top news provider, independent. I would advise anybody to go onto his website, check through his videos. The man works and his team work tirelessly, sharing information, no bias, no political bias. Not working for any major, no corporate interests involved here whatsoever. But His videos have been taken down from YouTube. He's on the brink of losing. I think he might have lost his Twitter account. I'm locked out of my Twitter account because I shared a video that Last American Vagabond showing a nurse in America who unfortunately had suffered very severe adverse effects after having the Pfizer vaccine, Bell's palsy. Apparently, I cannot get into my Twitter to this very day unless I agree to take that video down. And I've refused, and I'd rather lose my Twitter account. Because, as I've said to Twitter, that lady has every right to share her experience as people who have had no adverse effects from the vaccines also have a right to share their experience. Because if there's nothing shady going on here, then why are we having this draconian level of censorship? And then, we find out that, Bill Gates is suddenly the biggest landowner in America. Donald Trump comes along, severely undermines the farming industry in America, covers it up with the sticky plaster of giving them all huge subsidies. Now he's going, so what's going to happen to the subsidies? Oh, it doesn't matter. Bill Gates is there to buy all the land. Now, don't people think that that is a serious problem? That when you've got this one man who not only wants to vaccinate 7 billion people with an experimental vaccine, of which there has not even been a peer-reviewed publication of the trial studies yet, okay? But already he's buying up masses of America's land, food production for the world. We're going to be dependent on Bill Gates. This is getting very, very, very serious. Never mind insurrection against the Capitol building. We're talking about an ongoing insurrection, a corporate insurrection against we the people, against our rights, using our media, wildly exaggerating figures about a pandemic, robbing people of their rights and livelihoods, damaging our children's mental health, their physical health, people's physical health, denying people healthcare in Britain. That's not news. The BBC doesn't think it's a matter of public interest to share this, an intensely peer-reviewed article explaining that the Imperial College has harmed our nation with the worst calculation in human history. In the history of humanity. And in my article here, which is titled Britain's Throwaway People, and it's talking about the elderly, and we cannot ignore the fact that Christine Lagarde of the International Monetary Fund, she did say this at Davos. I think it was it. I've put 2018 here. It could have been 2017. Okay. But at Davos, she did get up and say this. Old people live too long, and this is a risk for the global economy. We must do something urgently. And it is a fact that from 2017, the Coalition for Vaccination was talking about vaccination passports for Europe. From 2017. This is not a conspiracy theory. We're talking about planning. We're talking about very rich, wealthy people talking about basically culling the elderly. What else could she mean? Old people live too long and this is a risk for the global economy. We must do something urgently. What is the urgent thing you must do then if old people are living too long and it's a risk for the global economy? What must you do? Must you kill them? Isn't that what's been going on that masses and masses of elderly people are dying, and that elderly people are the first in line for these experimental vaccines. And we're hearing all kinds of stories coming through the news that, you know, within weeks, suddenly, you know, 24 people in an American nursing home have died after not losing anybody to COVID-19 for all of this year. And suddenly they have the vaccine and suddenly there's 24 dead. And similar things happening in other places. And how many of these stories are being kept quiet by a complicit media, a BBC that is working against the public interest and in favour of big corporate people like Bill Gates. Bill Gates actually gets into number 10 to sit a corporate big pharma vaccine manufacturer, soon to be our main food supplier. Well, for America and probably Britain, considering Britain's going to be getting a trade deal apparently with America. And dependent on America then, Bill Gates for our food. These are very serious issues to be talking about and asking questions. And the BBC isn't asking questions. And that's why I've repeatedly stated again and again and again and again, people of Britain, you're going to have to do it. Get on your doorstep, a doorstep protest every night of the week. Bang your pots and pans. Be it for our human rights. Stand up for our human rights. Because no, we're not all going to storm Parliament. We're going to get on our doorstep. We're going to do a doorstep protest. Bang your pots and pans. It is the least we can do for our human rights because they are going gone. We need to remember our forebears fought for those rights. They struggled for those rights. Our grandparents gave their lives for those rights. The least we can do for the next generation and every other generation after is to stand up for them, because Bill Gates is not God. Bill Gates is actually, he's got to be a total psychopath, and in which case he's only half an intellect. He is a half-wit. The man has no compassion, because what kind of a person would even dream of vaccinating 7 billion people with an experimental vaccine on strength of a pandemic that actually is based on the worst miscalculation in the whole of human history, and that has caused masses of mental health damage to our children, and children have been committing suicide. Children who are at least risk. There is a time to ask some serious questions. So, yes, we do our protests, but at the same time we back that up with legal action. And we do need class actions. And we need the lawyers to come forward because we want prosecutions. And damages paid. Okay? There is a case here for some serious compensation from this government, from all the authorities that have been, and corporations that have been feeding off this serious miscalculation. And we do need to do it, because that is our right. And if you can't do it, Britain, then don't complain. Okay? When suddenly you wake up one morning and you find out, well, actually, you haven't even got a right anymore to stand up for your rights. Because, you know, that is where we are heading. The children of tomorrow will know who to thank, won't they? I.e., the people who did nothing. But watched the BBC and jumped when BBC clicked its fingers.